All right, Dr. Lee, thank you for joining us today and giving up some of your valuable free time.
Of course. Happy to be here.
Great. So we have kind of some stock questions we will go with, and then we'll have some free time at the end. And our first question is, kind of a very vanilla question, but it's a great and popular question. So can you tell us about your hometown, your undergraduate school and your major, and then what medical school you went to?
Okay. Well, so my hometown, I talk about this all the time. Everyone's like, where are you from? Where are you from? So I'm originally from Korea. I moved when I was 12. And I grew up mostly in Indiana. So I went to Purdue. My major was French. I minored in Spanish and forensic science, and I did pre-med. And the reason why I picked that was because I always knew I wanted to go to medical school. So I wanted to be a little bit more in my head, it was a better thing to be well-rounded than very science focused, because I was going to do science for the rest of my life. So I did, study abroad in France, study abroad in Argentina. And then my broader goal was for me to, maybe do some volunteer work. Doctors Without Borders, it's a French organization, and they prefer French speaking volunteers. Yeah. So I was like, oh, maybe if I major in French, I'm gonna be able to do that. I'm just conversational. But for medical school, I went to Kansas City University, or KCUMB, now KCU Com. Yeah.
Awesome. That's really cool. I speak Arabic from when I was in the military, so I think the foreign language as a doctor is a really cool thing.
It's a good thing to be able to communicate with your patients. Yeah.
Yeah, I also speak Arabic, but I'm pretty sure Zach's Arabic is better than mine.
Mumkin.
Even though I'm Middle Eastern. But that brings us to the next question. So why this field of surgery specifically?
So I remember when I first shadowed a plastic surgeon when I was, I believe, in high school. I was junior or senior in high school, and I was just, casually shadowing different types of, medicine doctors and surgeons. And I remember one of the cases that we were doing that day was a breast reconstruction. And to me, even though I was like, oh, plastic surgery is cool, but when people hear plastic surgery, they often think, cosmetic procedures, nose job, facelift, breast augmentations. But when I was there and saw the breast reconstruction, and I was able to interact with the patient, and one, it blew my mind that, there's a reconstructive procedures. I mean, I guess if you really think about it, it makes sense, right? But that's not something that you hear about unless you're even in medical field. So it blew my mind that that was something that they did, plastic surgery did. And then two, the fact that I was interacting with my patient, and the patient was so grateful and so thankful and was so happy, besides being grateful and thankful of the care that she was receiving, but it was just, I could see the impact that it was having on her. It was, after her breast cancer, this was the end, right? This was the end of her journey. She was so it was restoring her quality of life. And I could not imagine doing anything else but that, restoring, quality of life for people who, to be in that journey. In medicine, oftentimes we are, unfortunately facing, diagnoses that are, maybe not favorable or whatnot. It's a lot of times, oftentimes not always happy, right? All these journeys that we take with patients. And I felt like plastic surgery patients are usually healthier, and then patients are happier to be seen by us. And that was a big part.
Yeah, that's really cool. When I saw you present in the fall at the ACOS conference, I was like, this is not what I expected plastic surgery case. This is really pretty cool.
Yeah.
I like it.
No, I feel like, a lot of medicine, I mean, there are different ways to restore quality of life. And I felt like this is you can see the restoration, you can see how your patients progress. And I just thought it's no other field does what we do. I felt.
Well, that brings us to our next question, which is, why did you choose the residency program? And maybe you could mention what residency program you're at. And did you have any special criteria when you were looking for a program to go to?
Mm-hmm. So I am currently a PGY2, soon to be a PGY3, which is crazy, at Cleveland Clinic, main campus. So why this residency program? I am completely biased and I will tell you that before I even start speaking about my program, but I love my program. We have a very tight-knit group, as well as, our attendings are so supportive, encouraging. We have great education, we have great surgical volume, we have great diversity of surgical cases. We do a lot. I think that our program is so well-rounded as well. We do trauma, we do aesthetics, we do reconstructive, we do all bread and butter plastic surgery cases. So I couldn't imagine being somewhere else, because this to me offered everything that I wanted. And I guess some of the criteria, if I could say, like I was looking for these things, the most ideal things for me was, a good group of residents, great group of staff members who, I would feel comfortable asking questions, that I'm not intimidated by, their, and I mean, everyone is so intelligent, everyone is so, high achieving, but that was very important, feeling that I would grow and I would learn as a surgeon, somewhere where I'm able to interact freely and, discuss and have conversations with. Um, and Cleveland is actually really great. I've never been to Ohio before, and Cleveland gets a really, really bad reputation, but we have great art scene and a really great food scene, great hiking trails. Yes, these are not mountains like Denver, but, it's really a nice place to live too. I guess a few other things to think about is, are you close to family? Because, 6 years of residency is a long time. So if you are like looking for more support, that's something to think about. I think that for me, I wanted a very well-rounded training, but if you want to go into a very certain niche, academic place, then you have to think about that too. Like, is there a fellowship after that residency program and whatnot? Um, but yeah, I mean, I did a rotation here as a fourth year, and I just absolutely loved like the everything about this place.
That's awesome.
Yeah.
Yeah, Cleveland is a really cool city. I've been there, so I'm like, it's nice. But other people, they just hear about it, and I don't know why it has a bad rep. It's a cool
Yeah, I
city.
don't know. I mean,
Yeah.
it's nice. I like it. I'm enjoying it, and it's very affordable. I think that's also something to consider as, whether you do plastic surgery or anything else. I think that's affordability is actually a big thing, I think.
Always a plus, definitely.
Mhm.
Okay, so the next question is, what is a typical day for you? So this series is called A Day in the Life. Obviously, every day is different, and you probably have different things every day, but just walk us through, like, when you wake up in the morning until, like, all the way through your day until night.
Yeah. Well, so like obviously it depends, but like a typical day would be, wake up and then you go in and you chart check your patients, you get your rounding list, you go on rounds, you take care of patients that morning, discharge the patients that you need to discharge. Sometimes we have morning conference, so you go to the morning conference. That means, you wake up a little bit earlier than usual to go around and do all the stuff. And then after your morning conference, you go to cases, all day. And then in between cases, we do some floor work, discharge more patients, or, put in some more orders, or if there are any sick patients, you go in between cases to check on them again. And then, we operate a lot, at Cleveland Clinic. So we are like in the OR, like all day, every day. Um, and and then you go home, at the end of the day, if there are patients that are staying after, and then you want to go see them, you can go see them. If it was a big recon case, micro case, then you want to go see your patients before you go home. So I would say that's the most typical day. And if you're on call, then you do all of that, plus you take call. So you go to the ED when you get called. So pretty typical. I don't think that um, it's much different from any other residency.
What's the time? Like, what time do you come and go usually?
So it depends on your rotation. Usually, I know it's like, but We typically, it depends, but I would say I wake up around like 4:35 every
Mhm.
day. Yeah. Like just like any other surgical specialty. I think that people do have like this idea of plastic surgery being, maybe you don't have to work as much or work as hard because it's plastic surgery, but we do see patients too. So
Yeah, that's awesome. So the next question, obviously you're early, but hopefully have some idea, or maybe not. But what type of setting do you hope to practice in? And that also includes like, are you thinking about a fellowship,
mhm.
that kind of stuff? And it can even be location too, if you're thinking about going to Hawaii or something.
Hawaii would be nice. So, I think that we all have ideas of like what we want to do, when we're in medical school, and then you go to residency and you like sort of see more. And then sometimes things change and sometimes things don't. So I originally thought that I wanted to be in big academic centers and do big cases, like big reconstructive cases. And because we briefly talked earlier about this too, but um basically I think that reconstruction provides such like a big restoration to quality of life, and it's such an impactful thing for patients. um but not that doesn't what I realize is that in order for you to do reconstruction, you don't have to be in big academic settings unless you are looking for really complex big cases, which I thought, that's really cool. But I think that like all of us, we when we're rotating in third year and fourth year, we don't get to see, I mean, we try, but we don't get to see everything about the field. And now that I've been in it for almost 2 years, I've seen so many different cool things. I haven't really experienced a lot of hand surgery as a med student, and hand surgery is so cool. And then I haven't really seen a lot of transgender, like gender affirmation surgeries, and I'm seeing a lot of those, which I think are amazing. And even like facelifts are amazing. So like basically you get my I am completely undecided. I think that now I'm just like confused because now I like it all.
Cool.
That's a good problem though. So whatever you choose, you can't go wrong.
I hope so.
What if
Yes.
you go up to residency and realize, oh, plastic surgery is not for me?
Bummer.
Okay, so the next question is, do you have any advice for people considering plastics? Um, and
Yeah.
that can be for all years.
Yeah. So I think that advice for people considering plastic surgery, especially, students who are even first year or second years, and they're, you might think, well, I still have like a year or two to decide, I have to think about like my step scores, blah, blah, blah. Well, now that the step score is going away, that's like a different thing, but
Not for us.
I know we gotta go back and study. um, well, I think it's really important that if plastic surgery is, at anything that you would like to pursue, or if there's any like sliver of, possibility that this is what you want to do, you should be actively searching for mentors, actively, looking for places that you can shadow, do some research. I think that's very important because um, plastic surgery, there are different ways to get to plastic surgery, but if you are considering integrated plastic surgery program, like, the one that I'm in, um, unfortunately, plastic surgery is competitive and they like to see, research. Research is one of those things where people, unfortunately, um, can differentiate themselves. I say unfortunately because I think for osteopathic students, it is difficult to find opportunities oftentimes because we don't have university hospitals affiliated with us. We don't have plastic surgery program, affiliated with us where we can go to their journal club, go to their program director and say, hey, I'm interested, or can I shadow? Can I be involved in a project? So I think it's really important that students seek out opportunities and mentorship early on so that you have you have a plan, you have a game plan. And then, in the end, third year rolls around and you're like, oh, you know what? I actually hate plastic surgery. This is the last thing I want to do. Then you have all these things on your resume. And then that's going to add to your resume no matter what. And then you are going to be able to go to a great, radiology or great internal medicine or great general surgery programs that you want because you have all these experiences. It will make you stand out regardless.
Okay, and just as a follow-up question,
Mhm.
should it be like plastic specific research or just surgical research in general? And then can you describe the different ways to get to plastics for those who might not know?
Yeah, yeah. So let's talk about different ways to get to plastics first, and then I can
Sure.
talk about, what makes you the research stuff. Different ways to get to plastic surgery is one is, right out of medical school, you go into 6-year program of integrated plastics program, or you can do general surgery, which is 5 years, and then you apply to a fellowship, plastic surgery fellowship. So we call those independent fellowship, and independent fellowship for plastic surgery is 3 years. Um, so that's a couple different ways.
Mhm.
And for research, I think that if you are unable, like you've tried and you are unable to get, connected with someone who's doing plastic surgery research, then I think any research is good. You know, um, if you want to be more picky, I think that um, you want to try to find a mentor who is a little bit productive so that you're not doing research for 2 years and you don't have a paper. Like, when I was in college and I was shadowing one of a different plastic surgeon, because I was shadowing different plastic surgeons and trying to get their advice, one of the plastic surgeons told me, so what is your goal? Like, what is your goal? And I was like, well, my goal is to become a plastic surgeon. I want to be a plastic surgeon. And he was like, no, that is not your goal. Your goal is to get into a plastic surgery residency. And that stuck with me. And that's actually very true. You cannot become a plastic surgeon if you cannot get into a residency. And then in order for you to get into residency, you have to think about what the requirements are. And then you have to break it down, right? So, you know,
That's really good. That's a good insight.
I thought that was very good.
Yes, very true.
Mm-hmm.
Yeah, and I think it's something to keep in mind, even no matter what specialty you're, even if you're interested in, any surgical specialty, any non-surgical
Yeah,
specialty, it's
I
good advice.
100%. And another thing that stuck with me was like this is a different doctor who's told me, before you become a great plastic surgeon, first thing first is that you have to become a doctor. You have to become a good doctor, then a good surgeon, then a good plastic surgeon. So there are like ladder to, like you can't just do this, you gotta step by step. So I know it's like daunting for all the students out there that's, maybe not pursuing plastic surgery, but, pursuing, anything, one step at a time. You're doing great. Everyone doing great.
All right. Well, on that note, this question is one of my favorite, which, hopefully you like it too, which is that can you describe like a favorite case or a favorite patient or like, I really love doing this procedure or, anything like that? Obviously keeping, privacy in mind and all that stuff, but
Right.
we love hearing about, your favorite thing about your, favorite case or patient.
Right. So I feel like, like I said, I have like really liked everything that I've seen. So it's really hard for me to pick a favorite case. But let's see. I think as a medical student, I had one of the favorite cases that I would always describe was this crazy sarcoma reconstruction. It was a 2-day thing. So the first day, it's like a multidisciplinary procedure. So, there's vascular surgery, neurosurgery, general surgery, doing exposures, and all of that. And then we were there first day. I think that was the supine, or no, was it the No, that was prone approach first and then supine later, or vice versa. And then anyways, so the first day we harvested the fibula flap. So, but it was delayed. So basically what we do is we go there, we dissect the flap out, but we just like leave the vasculature intact, but we cut everything else. And then the next day we also did a VRAM, which is the vertical rectus abdominis muscle flap, to reconstruct. So we were using that skin and then the rectus muscle as a paraspinous muscle because the sarcoma was like in the back. And then we used the fibula bone to reconstruct the spinal column. And it was like a 2 flap reconstruction case. And I thought that was so cool.
That's pretty cool. And did you get to help with that procedure as a medical student?
Yeah, I mean, I was there. It was really great. But I will say, besides those crazy cases, I really enjoy like distal radius fractures. doing doing those exposures, it's like a puzzle. And then I really like facelifts too. Facelifts, you see great anatomy, all the, obviously you don't want to see the nerves, but it's like the planes are great and things that you see. I mean, there are great cases, like head to toe, everything.
Awesome.
Mhm.
Okay, so this brings us to our last question. So this is kind of just a general question. If you have any advice for students, in we talked about research already, but maybe on boards or on any criteria for matching that you think are particularly important. Um, and you can just also touch a little bit on surgery kind of being a boys' club
Mhm.
and how you as a female in plastics interpret that and how you feel in your residency program and maybe with patients as well.
Mhm. Okay. So, first, just generally, generally speaking, for like we've already sort of touched on it, but I think the most important thing, if you are interested in plastic surgery, is, kind of start doing research on what is plastic surgery, what kind of lifestyle does plastic surgery give you, and is that compatible? Is that something that you want? I guess even before that, you have to decide surgery or medicine, but at that point, you already. So then think about that, and then if you decide, yeah, this might be something that I'm interested in doing plastic surgery, then I think that you have to reach out early and you have to start making that game plan. Like if you're a first year, then start going out and shadowing local plastic surgeons, see if they're doing any projects, even like some case report. Try and tell them, I'm very interested, like get me involved, please. you know and then as your second year rolls around, then you have your scores, your board exam. So try to do well on your board exam. And I don't know how this, like, not having a score really works. I guess it's to be determined for all of us. But I think that it's important to focus on your academics as well, because like we said, you have to be a good doctor before a good surgeon and before, a good plastic surgeon. And then in order for us to be a good doctor, we need to, do some work on our academics. So, I think that's also very important the first 2 years. Then as you're going through your first 2 years, you can think about, so what am I going to do if after 2 years of medical school I feel like I'm not going to be competitive, you know as a applicant? And I guess you might think, I don't know, like, how am I going to know if I'm a good applicant or not? How do I know if I'm competitive? I think that, one, you can always just reach out to a program director of your choice, a program that you've maybe already connected by, your local, university hospitals or whatnot, and say, hey, here's my CV. What do you think about my CV? Am I productive? Like, have I been productive enough? Like, what can I improve on? You can do this early second year, or, whatever. And whatever feedback you get, then you kind of tailor your plan to that. Like, I actually took a year off between my second year and my third year and did a, fellowship. I did an anatomy fellowship at my school. And that's when I did my research. That's when I had my publications. So that was always the plan, because I knew that, I wasn't going to get very many research opportunities my first 2 years of medical school. And, so I've always decided I'm just going to take a year off, and that's the time when I will be productive. So that's two different approaches, right? If you are someone that I don't want to take a year off, that sounds crazy. Like, why would you want to do that? Then don't do it, right? But I think you have to have a plan. You have to have a plan that you're okay with. If you're okay with never going out on a weekend the first 2 years of medical school, and then, writing papers, studying, do it, because that will get you into a residency. And then, your third year clinicals, I, like everyone in, osteopathic school, it is difficult to find plastic surgery rotation as a third year. Main reason being, we don't have a university hospital that's affiliated with us. And with that said, you have to do the legwork. And some schools will actually say, oh, you're not allowed to do, X, Y, and Z. You're not allowed to reach out to a surgeon or, your rotations, on your behalf. Then I think that if that is your school, and if that is the case, and you already know that you want to do plastic surgery, you have to think ahead, right? So then you have to, talk to your school during your second year and say, hey, this is what I want to do, and please support me, because I think with your support, I can be successful and I can do this, and do that, and then find rotations, with or without their help. Go find rotations. I was very lucky that my first rotation was in general surgery, and I was with a breast surgeon, and my breast surgeon had, mastectomies. And then after that, a plastic surgeon came in to do the reconstruction. It was a same day combo case. And then as soon as I saw that plastic surgeon, I was like, this is my plastic surgeon this year. I have to get him to take me. So I stalked the board. I stalked the OR board. And whenever he was around, I would try to pop in and tell him, hey, can I just come watch? Can I come assist you? I was totally annoying to him. And then, at the end, I asked him just straightforward, can I please do a rotation with you? And he let me, and he's never taken students before, but it takes a little bit of encouragement, I mean, not encouragement, courage. I think that it's very scary as a medical student approaching surgeons or any doctors, because you think that, oh, they're gonna think that I'm just like this really stupid medical student, super annoying, I don't want to bother them, they're very busy, blah, blah, blah. But I think that you have to go into this, or any opportunities, thinking, if I don't do this, what's going to happen? One, you might regret it. But if you pursue it, what's the worst thing that's going to happen? They're going to say no. But that's it. But it's so much worse, right? If you just think that I should have done that. I should have done that. But, months go by, years go by, and then you never did it. So go be brave, and, go chase after your dreams, find that plastic surgeon that I found, that I still, he's my great mentor, I still talk to him, and I think that you have to go out there and make your own connections. Oh, and then I guess the next one was what we're talking about, being a female in plastic surgery, right? So I think that I think your previous videos have already mentioned a couple, female surgical residents and their experiences, being called, you go to bedside at a patient's bedside, and then the patient's like, oh, hey, can you get me the cup? Or can you give me ice chips? Where's the doctor? That happens to me too. And unfortunately, I think that's just something that we will face. Um, and I think the best thing that we can do is we have to educate our patients, right? And we sometimes I get that, I go to the nurses station to ask for help, and I get that too, like that blank stare, like, why are you asking me that, sort of a look, like, who are you, sort of a look. And I think we need to educate, like, our general population to stop that, to have, like, you know equal respect. I don't know how even to put it, because if I weren't a female surgeon or female resident, I might be treated differently, right? um, I am very fortunate to be at a place where we are very supported by our faculty members, our colleagues, our male colleagues and whatnot. But I think plastic surgery also is sort of a unique field where a lot of our patients happen to be female patients. And I think that it could be to our advantage later when we do become a plastic surgeon, female plastic surgeon, that a lot of female patients actually feel more comfortable sharing their insecurities with us, or their problems with us. So maybe it will end up being a positive thing. But um yeah.
I think
Awesome.
that's a
Yeah, and I
great
think
way to look at it.
yeah, and I think that's great life advice about not wanting to regret not doing it rather than, you know,
Mhm.
worrying about getting a no answer too. So I really appreciate that. I was just telling someone the other day about a similar thing about trying to be more confident for that exact reason, because what's the worst thing that's going to happen?
Yeah, I think that we have to just do it. Just do it.
Awesome. Well, I really appreciate your time. This has been really great. All of these interviews are always, I always learn so much from the different specialties, especially specialties that I don't know as much about. And plastics is definitely one of those specialties. So
Mhm.
unless Katie has something else, thank you so much.
No, thank you so much for your time.
Yeah, of course. And I really do encourage everyone to, like, reach out sooner rather than later. Even the residents, we're not scary. Yes, we're busy, but we're not that busy. If we don't answer in like 1 week, then, text us, email us again. Like, we do forget, but we are more than happy to, like, help and, try to guide you guys.
Awesome.
Thank you.
Thanks.